Hello everyone, this is my presentation on spinal muscular atrophy. So, spinal muscular atrophy, or SMA, is a group of hereditary diseases that progressively destroy nerve cells in the brainstem and the spinal cord that control essential muscular movement and strength in our skeleton. The activities that are affected are speaking, walking, breathing, swallowing. These activities are weakened and they usually lead to muscle weakness and atrophy. The motor neutrons that control movement in the arms, legs, chest, face, and throat and tongue, they are disrupted by the disruptions in the signals between the motor neutrons and the muscles. The muscles gradually get weakened and they begin to waste away and develop a twitch. So there are 4 types of SMA. Babies that are born with type 1. The most common type may be severely disabled. They won't be able to sit or stand, and they may even pass away before age 2. Children with type 2, they typically need help walking, standing, and have a shortened lifespan. Children with type 3 are less disabled, and they may be able to stand on their own, sometimes with help. And then type 4 begins in adulthood. The most common form of SMA is caused by defects in both copies of the survival motor neutron gene 1, or SMN1, on chromosome 5q. This gene produces a survival motor neutron protein which maintains the health and normal function of motor neutrons. Individuals with SMA have insignificant levels of SMN proteins, which leads to a loss of motor neutrons in the spinal cord, producing weakness and wasting of their skeletal muscles. This weakness is most often more severe in the trunk and upper leg and arm muscles than the muscles of the hand and the feet. So screening is done before or during pregnancy. And this allows the parent or future parent to find out the chances of having a child with a genetic disorder. Carrier screening for SMA will tell the patient if they are at risk for having a baby with SMA. However, this screening does not give 100% certainty. Also, if screening shows that both parents are carriers, the results cannot tell how severe the disease will be if one of their children inherits this disorder. So the carrier screening is done by testing a sample of blood. One parent is usually tested first, and if the results show that the first parent is a carrier, then the other parent is tested at this time. So who needs to get this type of testing? Basically, any woman, all women who are thinking about being pregnant or who are already pregnant, they should be offered this type of screening. There are no contraindications at this time. And also, I want to point out that you can have the screening for additional disorders at this time as well. They can choose to have a carrier screening, or they can choose not to. It's really no right or wrong choice, but it should be made available to them. Okay. So, as I said before, the carrier screening is a type of test that would tell whether you carry a change in the gene for certain genetic disorders. The screening is done by taking a sample of blood, and one parent is tested first, and then if those results show that one parent is the carrier, then the other parent is tested. If the mother is already pregnant, somehow maybe they didn't get this type of testing. They can have an amniocentesis procedure or a chorionic villus sampling to see if the fetus has SMA. So the advantage of this type of screening is the earliest possible diagnosis and treatment for SMA through newborn screening leads to better motor development and less need for permanent ventilation, as well as fewer deaths. The earlier the disease is diagnosed, the earlier the doctors can start the treatment. The greater the benefit for the children with an early onset of disease, okay? So the sooner they can get the treatment going, the better, all right? The advantages are mainly seen in the better development, such as achievement of motor milestones like free sitting or freestanding, which normally with this disorder, a child may have issues or problems doing. So there are no disadvantages identified at this time. So how do you interpret the results from the screening? Well, the carrier screening results for SMA are reported as a number of healthy copies of SMN1 the person has. So what is a normal finding? If a patient has 2 copies of healthy genes, it would mean that they have a reduced risk of being a carrier. If that patient has 1 copy of SMN1, that means the other copy is faulty and they are a carrier. That patient could pass a faulty copy of SMN1 gene to their child. At this point, the next step would be to have their partner tested. If the partner is also a carrier, then the risk of having a child with SMA is 1 in 4. The patient would be at risk for having a child who is a carrier would be 1 in 2. If the partner has 2 healthy copies of SMN1 gene, the risk of having a child with a disorder is very low. So what do we do to follow up with this patient? We basically just tell them these are the options to consider, because of course they can always decide that they don't want the screening, or make whatever type of decisions that they want to make. So if the patient is pregnant, the patient again could have the amniocentesis or the CVS procedure to determine if their fetus has SMA. If the patient is not pregnant, then they can also consider, and they, let's say they test positive, then they can consider being pregnant using vitro IVF or vitro fertilization. The patient can use her own eggs or sperm, and they can also use donor eggs or sperm. Tests can be done on the embryo before it is transferred into the uterus to see if it has SMA. All right, this is called pre-implantation genetic diagnosis. The patient can get pregnant also with intrauterine insemination. With this option, the sperm from a donor who does not carry SMA would be used. Okay, the patient can also choose not to get pregnant if they're not pregnant, and then they could also choose to adopt a child if they find out that they carry. They have this disorder, they're a carrier, and they don't want to pass this to their child, or even have a child that may have this type of disorder. So these are things. The basic thing is, you want to follow up with the patient because you want them to know their options. If before they get pregnant, these are your options. And if you're already pregnant and you want to find out, if this is a situation that may affect you or your unborn child, that's why you want to present these options to them as well as follow up with them. So client teaching and counseling. Of course, no parent wants their child to be imperfect, that everybody typically they get pregnant, they want to have a perfect child, and so this may be a difficult moment for them. So we can suggest a support group in their area if that is possible. But if not, we can start to prepare them for, what may be coming once that baby is delivered, or if they are pregnant, if they want to get pregnant, or if they are pregnant, we're preparing them for what comes next. Either way, they may need a support group, or they may want to know that with this child may have breathing issues. The child with this, if they do, they may need a special mask or mouthpiece to help with their breathing. Swallowing and nutrition may also be an issue. Babies or children with SMA can have a hard time sucking and swallowing, and suggest working with a nutritionist to help with that. And some babies may even need a feeding tube, so that is an option for them as well. Also want to point out that the muscles with the breathing issues, weak muscles keep the air from flowing easily in and out of the lungs. If this happens, this is the reason why they would need the mask or a mouthpiece to kind of help with breathing. All right. And with the swallowing and nutrition, the muscles in the mouth and the throat, as they become weak, babies and children with SMA have a hard time sucking and swallowing. In this situation, the child may not get good nutrients, and so this is why, and they may have problems growing. And so this is why working with a nutritionist or even using a feeding tube may be very helpful. Preparing them for issues that they may have with movement. So physical and occupational therapy are very helpful. These type of therapies use exercise and regular daily activities to help protect the child's joints and keep their muscles strong. The therapist may also suggest that they wear lead braces, use a walker or electronic wheelchair. Also, special tools can help control computers and phones to help with writing or drawing. Anything to create some type of normalcy. And I think that just providing this type of information, it's a resource for some, but it also prepares the parent for what may come, and there's no way to say, like we learned earlier, how severe their child may be in compared to another, but at least this is giving them a heads up. And hopefully during their pregnancy, they could be making some type of preparations. One of the other notes I made was back issues. So the child may develop a curve in their spine, and their doctor, or we may even suggest that the child wear a back brace while the spine is still growing. When we stop growing, they will have to, when they've stopped growing, they may have to have surgery to fix the problem. All right. Just a good heads up. And so I think this is also good because it helps them to prepare emotionally, as well as financially, and just getting ready for what is to come. That maybe your baby is still perfect, just different. Okay. All right. So a couple of medications that can be used. Please excuse me if I mispronounce these, but the first one is Spinraza, and this is given through 4 initial loading doses and a maintenance dose every 4 months, which increases the production of usable protein from SMN2. This treatment has shown to be effective in halting the disease progression and providing some improvements for patients of all ages with SMA. All right. And Zolgensma, I don't know, is a gene therapy administered as a single infusion, which replaces a faulty copy of SMN1, which has shown to halt the progress and improve the function and in the treated individuals. It's only available for children under the age of 2 years old. And then there's Eversidai, I don't know. Or raspadiaplam. Let's try that one. Excuse me for not pronouncing that correctly. It's an oral medication given daily to individuals that are 2 months of age or older, which modifies the splice site of SMN2 to increase production of the functional SMN protein. Everything is to try to slow the progression and, improve their functionability, that they're able to function as close to normal as possible. Well, these are my references, and that concludes my presentation.